And this tournament because I know I trust you with this job. Do you trust yourself? It's fresh.
Yeah, we are supposed to be. Had 1,924 samples, and we received 1,498 results, and the positive are 161, negative 1,280, and among these, the gender issue, it appears that 51.8% of the gender are male, and the remainder 48.2% are female. So you can see men are still, even in the Tharaka Nithi, men are still getting more positivity in terms of COVID, and that is what has been observed the world over. We are not too sure as of now why it is that men are exhibiting this positivity rate compared to their counterparts, women. And distribution of positive cases in sub-counties. We have Chuka sub-county. In Magumoni ward, we have 8. It doesn't mean that they are still there. Some of them are recovered. This is cumulative, according to our reports. Mogwe, 7. Karinga, and the highest, 31. Bringing a total of 46 in Chuka sub-county. Igambangombe sub-county, in Mariani, we had 4. Igambangombe, 10. Bring a total of 14. Tharaka South sub-county, Kariga had 1. Marimanti, 14. Nkondi did not record any. We shall actually question why. I'm not trying to say that they must have, but I would like to know how many tests were done to declare that you had a 0. You know, if you don't do a test, then of course you can't report positivity or negativity. And so you find that the South, Tharaka South, had 15 total. Tharaka North, Katonga, you have 1, and that was a male. Mukodhima, you had 2 males and 2 females, totaling 4, and a total of 5 in that sub-county. Mwembe sub-county, Chogoria had 20. Chogoria ward had a cumulative 20. Ganga, 10. Mwembe, 13. Bring a total of 43. Mudhambi, we had 4. Midero, 4. Bring a total of 8. And some of the patients that we tested are from other counties. Those we tested whose domiciles are in Nairobi were 4. Meru, 9. Embu, 14. So you can see Embu had the majority of the people whom we tested here in the Tharaka Nithi. And the people that are currently in facility isolation, those that are in Chogoria Hospital are 2. Komarok, 1. Totaling 3 already in isolation. And those that are in home-based isolation care, Chuka, we have 15. Tharaka South, 7. Tharaka North, 3. Mudhambi, 3, bringing a total of 28 those that are in home-based care. I know, judging from some of the communication we have had with some of you, you might be interested to know how are we faring, we health workers. Sadly, some of us also have been infected by COVID. It is not a respecter of anybody. We are just human beings like anybody else. The number of nurses affected in the Tharaka Nithi County cumulatively was 18. Clinical officers 4. Laboratory officers 3. Public health officers 2. Support staff 2. Doctors 1. Community oral dental officer 1. Accountant 1. Nutritionist 1. Pharmaceutical technologist 1. And health records officer 1. Bringing a total to 35. Ninajua kuna wanafunzi ambao waliripotiwa kuwa wamepata COVID na tukaenda huko tukafanya contact tracing na tukascreen wote, na wengine hao sasa wako katika ile hawamu ya kufanyiwa retesting to see whether they are negative after the test positive. There are others that are indeterminate, that are not telling us whether they are positive or negative, and those were 59. Unfortunately, we have lost 9 of the people that had COVID. Some of the patients that we tested are from other counties. Those we tested whose domiciles are in Nairobi were 4, Meru 9, Embu 14. So you can see Embu had the majority of the people whom we tested here in the Tharaka Nithi. Na kazi nyingi mpaka tunasahau private groups.
Haya. Kusahau ama ilisha? Sisi tuliona ilisha.
Do you know we used to even plan? I love something comes suddenly.
Siku mingi tukajua hiyo imepita. Now people have known.
No. People have not known.